With the implementation of eStar, there will be a few changes to the medication administration workflow. These changes will especially affect medication administration for isolation patients. This module has been created to go over these changes and demonstrate the new workflow. After reviewing this module, you will be able to describe the changes in the workflow for administering medications to isolation patients that will occur with eStar implementation. You will also be able to demonstrate how to incorporate the changes into the current workflow in AdminRx. Incorporating these changes now will help you make the transition to eStar. There are 3 major changes that we will review. The first is that you will need to scan the patient's armband first, before the medication. The second is that high-risk medications will need to be dual-signed before you are able to administer them. The third is that medication alerts will need to be addressed individually before other medications can be scanned. These changes will have the biggest effect when dealing with isolation patients, as it means that you will not be able to scan all of your medications before entering the patient's room, and a second nurse will need to don PPE to co-sign your medications.
Hey, Mr. Holiday, I'm going to bring in your Tylenol.
All right.
Before entering a contact isolation patient's room, you will foam in, put on the blue gown, and then put on your gloves. If your patient is on droplet precautions, you will foam in and then put on your mask.
You doing okay?
I'm good. How are you?
I'm good. Are you in any pain?
Have a little bit. Got a headache.
Go ahead and scan you. What's your name and birthday?
Mr. Holiday. Birthday is 1/1/2000.
In eStar, you will need to scan the patient's armband first. While using AdminRx, you will need to continue scanning the armband again after administration. But once eStar is implemented, you will not need to scan the armband again at the end.
Oh, there's a warning. So I guess.
In eStar, if you scan a medication that triggers a warning, like if you're giving it late, you will not be able to scan another medication until you address the warning. Each warning will need to be addressed individually, unlike in AdminRx, where you can address them all together.
Okay, it says I need a co-signer. Hey, Jess, can you come help me co-sign this?
No problem.
In eStar, your high-risk medications will need to be dual-signed in real time. All of the high-risk medications will remain the same in eStar except subcutaneous insulin, which will no longer need a cosign in VUH inpatient units. Here is a listing of the medications that will require a dual sign. These medications can also be found at the website below.
Hello, my name is Jess. I'm just helping Margaret with the cosign.
Hello, Jess.
Hello.
As the dual signer, you will need to foam in, don your PPE, verify the 5 rights including patient, drug, dose, route, and time, and then dual sign the medication in the computer.
We've got heparin, and it's going to go at 2,000 units an hour with no bolus.
Okay, good. See that?
And then you can see his name and birthday.
Can you tell me your name and date of birth?
It's Mr. Holiday. Date of birth is 1/1/2000.
Perfect. Thank you, Mr. Holiday.
This is what the dual sign screen looks like in eStar. You will simply need to enter your VUNITE ID and password.
All right. Cosign.
Alright, thank you.
You're welcome.
After the medication has been co-signed, you can administer the medication as usual. In AdminRx, you will need to continue to scan the armband after the medication has been administered. Before leaving the room, you will need to remove your PPE and then foam out. As you may have noticed, these nurses have been working with the door open, If you have an airborne isolation patient, you will of course need to keep the door closed. After eStar implementation, when a patient is placed on airborne isolation and there is not already a computer in the room, a computer will likely be sent with the HEPA filter and will need to remain in the room. This will allow for the patient's door to remain closed at all times. Other than donning an N95 mask and keeping the door closed, the workflow will be the same as for contact. To review, with the implementation of eStar, there will be changes to the medication administration workflow. The patient armband will be scanned first before the medication, high-risk medications will need to be dual signed in real time, and medications alerts will need to be addressed individually before other medications can be scanned. Thank you for watching this module. Making these workflow changes now will ensure that your transition to eStar will be just a little bit easier.